Here in our webinar, Crystal Vision Eye Clinic's webinar that we are making each Wednesday at 8 a.m. Today we will talk about nystagmus, and today and next Wednesday our webinars will be addicted to the nystagmus and different approaches to diagnostic and to surgery. So Dr. Victoria Balasanyan today will talk about symptoms, causes, and diagnostics of nystagmus. What we can do for understanding their different surgical complications and other very important points according to nystagmus, what patients need to make a surgery and how we can understand their dosage of this surgery, what are the causes of nystagmus, and how we can help as for kids, so for adult people with nystagmus. So if you will have any questions during our webinar, please don't hesitate to write them in chat or in questions. We will be happy to answer on them after Dr. Victoria's talk. Thank you so much. Dr. Victoria.
Good morning, dear colleagues. I'm glad to welcome you all again, and thank you again for your interest. So to improve the quality of care provided to patients with various diseases of the visual analyzer, we have developed and implemented standards for the comprehensive treatment of patients with nystagmus. First of all, let's talk about what nystagmus is. Nystagmus is characterized by rhythmic, abnormal, uncontrolled eye movements. These movements can be horizontal, vertical, twisting, or a combination of these movements. Nystagmus can be convulsive or pendulum-like with variable amplitude and frequency, and can increase or improve depending on the position of the gaze, fixation, or closing of one eye. According to our colleagues from UK, who published the only epidemiological study of nystagmus in the general population, the prevalence of pathological nystagmus is estimated at 24 cases per 10,000 people. The same author claims that the prevalence of infantile pediatric nystagmus is 70 cases per 10,000 people. It was reported that this figure is only 6.7 per 100,000 people. The incidence of acquired nystagmus in children is estimated at 70% compared to 40% in adults. There are two types of nystagmus, congenital and acquired. Congenital nystagmus. This type of nystagmus starts in infants, usually between 6 weeks and 3 months old. Children with this condition tend to have it in both eyes, which move side to side. Usually doctors don't know the cause of the nystagmus in children, although it may be inherited, passed down from parent to child. Children with nystagmus typically don't see things as shaking. Instead, they may have some blurry vision. Acquired nystagmus. This condition occurs at an older age. It has many causes, including serious illnesses or drug and alcohol use. Opposite to congenital nystagmus, adults with nystagmus often say that everything around them looks shaky. The brain controls the movement of the eyes. Our eyes move automatically, adjusting when we turn our head slightly. This stabilizes the image we are looking at and allows us to see a clearer image. In people with nystagmus, the areas of the brain responsible for eye movements do not work properly. In some cases, it is unclear why someone has nystagmus. In other cases, nystagmus may be associated with other vision problems. Nystagmus may be associated with the following: The presence of nystagmus in the family history, albinism, lack of skin color or pigmentation, a wide range of vision problems in infants and children, including cataracts, strabismus, and focus problems. Problems with the inner ear, multiple sclerosis, stroke, head injury, taking certain medications such as lithium or anticonvulsants, alcohol or drug use. The main symptom of nystagmus is rapid eye movement that cannot be controlled. Usually the movement is side to side. It can also be up and down or circular. The movement can vary between slow and fast, and it usually happens in both eyes. In addition to rapid eye movement, nystagmus symptoms include sensitivity to light, dizziness, difficulty seeing in the dark, vision problems, holding the head in a turned or a tilted position, the feeling that the world is shaking. The main purpose of diagnosing nystagmus is to determine the genesis of the disease, as this affects the treatment. Often some patients require surgery first and only then outpatient treatment. So the diagnostic methods, such diagnostic methods as visual level potential or electroretinography, fundoscopy, OCT, MRI examination, help us to achieve these goals. A highly informative method is the examination of the retina using OCT. It allows us to fully assess the condition of the optic nerve, macula, and retinal layers. In combination with other diagnostic methods, it is possible to formulate a strategy for further treatment and make some forecast regarding its effectiveness. So at first glance, it may seem that retinal OCT is not very informative in the case of nystagmus due to the constant oscillation of the eyes, which distorts the quality of the images. Even in conditions of pure fixation, it is possible to detect or conversely disconfirm the presence of a specific pathology, as in the example when the fossa is clearly identified, showing that it is fully formed, which is key in the issue of verifying the diagnosis. Conversely, hypoplasia or aplasia of the macular region and thinning of the layer may also occur, which in turn indicates a pure prognosis for increased vision. In addition, it is possible to evaluate the condition of the optic nerve. For example, in this case, nystagmus didn't hinder the identification of the optic nerve disc and the measurement of its parameter, confirming the absence of atrophy. And so this makes it possible to diagnose optic nerve atrophy with confidence and take it into account in further diagnosis and subsequent treatment. If we talk about nystagmus, patients with good visual acuity are extremely rare. Moreover, most of the patients are children under the age of 3-4 years whose subjective visual acuity is difficult to assess. In this case, diagnostic methods such as visual level potential or electroretinography come to the rescue. This method allows us to assess the state of the conductive system as well as the functional state of the retina. In our center, such studies are conducted almost daily. They help to obtain the most complete data and conclusions concerning all the details of the conducting system and to perform an idea of the nature of nystagmus. As an illustration, I present to you a patient with nystagmus, whose case is a vivid example of the need for a comprehensive approach to diagnostic using the full range of diagnostic methods, especially visual evoked potential and electroretinography. In this patient's case, the visual acuity was 6/120, non-corrected in both eyes. To determine the cause of the low visual acuity, optical coherence tomography of the retina was performed. However, as you can see, it wasn't possible to visualize the fovea due to the large amplitude, high amplitude, and very frequent nystagmoid eye movements, as well as pure fixation. The information obtained from the risk assessment also didn't provide a complete picture for verifying the diagnosis. In this case, the study of visual evoked potentials and electroretinography provide to be extremely useful. The conclusions indicate that the dysfunction is limited to the conductive system, while the retina remains free of pathology. Even under conditions of low visual acuity and pure fixation, it is possible to identify specific and precise data for establishing the correct diagnosis. Now we will move on to the primary and most significant methods concerning nystagmus. It's nystagmography. To accurately determine the characteristics of nystagmus, both with and without optical correction, we propose the use of videooculography. High precision in checking objective data of the frequency and amplitude of the oscillatory movements of the eyes is critically important for the correct dosage of surgery. A unique videooculograph was developed by a team of authors from the Crystal Vision Clinic and developers from Barcelona under the guidance of Professor Igor Aznauran. This device has allowed us to enhance the accuracy of determining nystagmus characteristics, the frequency and amplitude of eye movements in the primary gaze position during lateral deviations. This comprehensive approach provides a complete understanding of the clinical picture of the pathological process and, most importantly, allows for the identification for the point of the nystagmus blocking. Quantitative assessment of the speed, frequency, amplitude, and direction of the nystagmus includes the following. Quantitative measurements of nystagmus characteristics, measurement of nystagmus speed, frequency, amplitude, correlation between frequency and amplitude of nystagmus and ametropia. Evaluation: how does ametropia, myopia, or hyperopia affect the frequency and amplitude of nystagmus. Accurate measurement of the angle of deviation, determining the angle of deviation in case when nystagmus is combined with strabismus, which is crucial for planning treatment. Recording of eye movements. Using videooculography to record eye movements allows us to accurately assess the dynamic of the nystagmus over time. Calculation of null points, accurate determination of the nystagmus blockage point is important for subsequent surgery planning. So these measures facilitate a comprehensive understanding of nystagmus and its interaction with other ocular conditions, which is improved diagnostic accuracy and allows us to determine a more effective treatment plan. For instance, in this patient, as you can see in the video, the nystagmus is blocked during maximum right gaze. This observation is significant as it illustrates the relationship between visual fixation and the modulation of nystagmus. The ability to block nystagmus with specific eye positions can be a critical factor in assessing treatment options and understanding the underlying pathology. The absence of nystagmoid movements in this gaze direction causes him to keep his head turned to the left, torticollis. This compensatory posture is commonly observed in patients with nystagmus, as they often adopt head positions that minimize or eliminate the oscillatory movements, thereby improving their visual stability and clarity. Understanding this compensatory mechanism is essential for developing effective treatment strategies and enhancing the patient's overall quality of life. When performing nystagmography on this patient, we can observe that in the primary gaze position, the amplitude of the nystagmus remained at 22 degrees. In turn, when the gaze is directed to the right, where you previously saw the absence of movements on the video, the device either does not register any movement or records insignificant oscillations. This indicates a point of complete blockage, which occurs when the eyes are turned approximately 34-38 degrees to the right. Further, when the eyes are turned to the left, the nystagmus significantly increases, reaching an amplitude of 37 degrees. Subsequently, the patient underwent surgery following the custom-bound protocol, which involved weakening the muscle through deep recession. In this case, the procedure was performed as follows. For the right eye, deep recession of the lateral rectus muscle by 3 mm, and left eye, deep recession of the medial rectus muscle by 3 mm behind the equator. After the surgery, the torticollis was completely eliminated and full blockage of nystagmus was achieved in the primary gaze position. This outcome indicates the effectiveness of the surgical intervention in stabilizing the patient's eye movement and improving overall visual function. Successful correction of nystagmus and associated head position reflects the potential benefits of individual surgical approaches to the treatment of this condition. This is further confirmed by nystagmography, where in the primary gaze position, nystagmoid movements are recorded, but now at a minimal amplitude of 2.5 degrees. Previously, as you remember, it was 10 times higher. This significant reduction in amplitude indicates a successful outcome of the surgical intervention, showcases improved eye stability and reduced oscillatory movements. Such results not only reflect the effectiveness of the surgery, but also enhance the patient's quality of the life by allowing for better visual function and comfort. Now, a few words about MRI examination. MRI of the brain and orbits is a valuable examination used to assess various neurological and ocular conditions. MRI is employed to visualize the brain, optic nerves, and surrounding structures in the orbits. It helps identify any abnormalities such as tumor, structural malformations, or signs of demyelinating diseases. It can help in diagnosing conditions like multiple sclerosis, optic neuritis, or intracranial hypertension. In certain cases, we performed it with a contrast. It can provide more detailed information about the nature of any abnormalities observed. MRI provides useful information for understanding the underlying causes of ocular or neurological symptoms. So it's an essential examination for patients presenting with visual or neurological issues. So MRI is conducted under the sedation to eliminate even the slightest movements of the patient during the examination. It allows to visualize the orbital and brain structures with maximum clarity by minimizing motion artifacts. The quality of the image is significantly improved, leading to more accurate assessments and diagnoses. This is particularly important in evaluating conditions affecting the brain and eyes, where precise imaging can provide critical information for appropriate treatment planning. Typically, if a decrease in the peripapillary retinal nerve fiber layers is observed on previous optical coherence tomography, MRI will often reveal thinning of the optic nerve and its sheets, which further confirm the diagnosis. Conversely, if the thickness of the nerves is within the normal range, this indicates that in the future, outpatient treatment courses aimed at improving visual acuity can be planned for these patients. So, as you have understood, nystagmus is an interesting and complex condition that requires a comprehensive approach to diagnosis and subsequent treatment. However, if we address this issue responsibility and carefully, we can certainly achieve success. Just in 1 week, Professor Igor Aznaurian will discuss surgical treatment methods for nystagmus and will show you some clinical cases with the Strava treatment technique. Don't forget to join us, and thank you, dear colleagues, for your attention.
Thank you, Dr. Victoria. Maybe we have some another questions about the talk that Dr. Victoria had about the diagnostic approach that she was talking about. We'll be happy to answer. Also, Professor Aznaurian will be in the clinic from September the 1st till September the 10th, having his consultations. And if any one of you want to see how it works, how we really use, how, for example, Gaze Lab works, and how we use it in Nystagmus and Strabismus diagnostics, and to see other approach that we use in our clinic, we are happy to meet you there. You can write me straight in WhatsApp, and I will arrange a meeting in the clinic for you and for other colleagues. So thank you very much for being with us today in the morning, and let's meet next Wednesday at 8 a.m. In our webinar about surgery of nystagmus. Thank you so much.